To love someone is to learn the song in their heart and sing it to them when they have forgotten it. And I just love that very much. Folks, I want to introduce today somebody that we're very lucky to have with us, and his name is Dr. Kevin Farrell. And he's sitting right here and was nice enough to come in today to educate us a little bit about dementia and Alzheimer's and other parts that fall under the dementia umbrella. He specializes in geriatric medicine, and I'm going to have him just tell us a little bit about himself and welcome him to the show.
Scott, thank you. I appreciate the opportunity to help educate people about Alzheimer's dementia and other types of dementia. Such a prevalent disease with such a huge burden. It terribly costly disease. It robs you of your humanity. It burns out the caregivers. It's just a real problem that the whole world's dealing with. We didn't even see this 100 years ago. We didn't recognize it. We didn't know it.
Or if we did, they called it something else, or just
right. And I think that there's partially that, but I think also that part of the way we live nowadays, we have factors in our lives that cause more of it. I think that one of the things people need to understand about a lot of disease is there's a lifestyle piece to it. And so, can you prevent people from ever getting sick? Probably not. But can you mitigate it? Can you lessen the burden? Yeah, probably. Lifestyle is a large part of it, and we'll get into more of that. But
okay.
I
want to insert something real quick here, just in for the sake of full disclosure here. Part of the impetus for doing this show today, for me and members of my family, is that we personally are affected by this because our father, my dad, Jack Lewis, has Alzheimer's. He was diagnosed in 2007, and lots of you guys know him here. He's Jolly Jack. But I got a chance to talk to him about it just for a moment the other day. He was gracious enough to agree to give us a short little interview about his memory. So I'd like to know if we can go ahead and roll that now. Lewis?
Hello there, sir.
How are you?
Delightful.
You are delightful. Dad, we're talking about memory and Alzheimer's disease today. Is it okay if we talk to you about it for a minute?
Yes.
Okay. Well, Pop, how do you feel about your own memory? How do you think it is?
As far as I'm concerned, it's okay.
If I were to ask you what you had for breakfast this morning, would you be able to tell me?
Nope.
Or how about your roommate's name? Do you know what that is?
Gene?
Used to be. Do you know what your roommate is right now up in your room?
Nope. Is
What?
that Fred?
It is. Good job, Bob. What if I asked you about what you did during World War II? Could you tell me that?
Build that airplane.
You did. And can you remember where you took jump training?
Fort Bragg?
Well, you were stationed at Fort Bragg, but then you took jump training.
Benning?
Fort Benning. You know what state that's in? Georgia?
Fort Benning, Georgia.
Fort Benning, Georgia.
Right. Oh.
And Fort Bragg, you remember what state that was in?
NC.
Yep, North Carolina. Are you a happy guy, Dad?
Yes, sir. Jolly.
Yes, you are jolly. That's why you go by Jolly Jack. Well, if you wanted to say anything out there to people who are having memory problems, what would you say to them?
Hello there.
Okay. All right. Well, hello there and goodbye, Pop.
GP.
Right. Thanks a lot, guys. We weren't able to hear it in the studio here, but what I was hoping to pass along there, Doc, was that, as often seems to be the case from a layman's point of view, short-term memory is greatly affected. Dad's is he can remember things for maybe about a minute, but long-term we were able to talk about him being a paratrooper in World War II. He can tell you that he was a Lambda Chi Alpha in college and where he went. So is that a common thing? It seems to be.
That's a very common thing. Short-term memory loss and the ability to learn new things are really the hallmarks of Alzheimer's dementia. There's several different pieces to the brain that have to come together for us to have coherent thoughts that we can enact things that we want to do from. So if we have a plan for something, we have to have some memory of what we want to do. We have to have some structure so that we can organize things, and then we have to have an ability to carry it out. And so a lot of complicated pieces have to work together for even the most basic things to have happen.
Right. Well, I have some questions written down here. We're going to go with the flow, but I have some stuff that I would like to get out, and a couple of them are just basic questions that people would like to have an answer to if they're answerable. And one is just in layman's terms, what is Alzheimer's? What is it? What is going on in the brain that causes this?
So current thinking is that Alzheimer's disease is caused by a protein being laid down inside of the brain in the neurons that's called an amyloid protein. We don't really know exactly what the instigating event is that causes that to start happening. We know that there's some genetic component to it, but we really don't understand what the true roots of that disease is yet. We're working on it, but we're not there yet. We know sort of what the middle pieces are, neurofibrillar tangles causing cognitive impairment, but we don't really know what's the starting point. I alluded to a little bit about lifestyle. My personal opinion, and literature supports it, some of it, is that lifestyle is a large part of it. The hallmark of all of this is inflammation going on in the brain. So inflammation going on in the brain gets these proteins to be created and deposited, and that causes the impairment. If we look at the body, if we look at cardiovascular disease, if we look at cerebrovascular disease, same processes take place. An inflammatory process caused by different things that you're doing to your body leads to the disease process. So
okay. You're talking about diet?
I'm talking about diet, I'm talking about diet, I'm talking about stress, I'm talking about exercise, I'm talking about all those modifiable risk factors that we keep harping on as physicians. All
right.
Those modifiable risk factors really do have an impact on your body.
Okay.
And it mitigates the disease that you have, but it also prevents new disease from occurring. And so taking care of yourself actually pays off. I think if you look and see what we do today versus what we did 100 years ago, we worked harder, we worked longer hours, we ate a clean diet, we ate foods that weren't
without all that
processed.
preservatives.
Right. We ate stuff that just was real tasty, but it wasn't good for us, what we're eating now. And so those things pay off. The right amount of sleep, the right amount of exercise, all that stuff comes together to have our body be healthier.
I want to ask about quickly. Some people may kind of put together Alzheimer's and dementia, but dementia is actually the umbrella that Alzheimer's falls under. Correct?
Correct.
They're not one and the same necessarily. It's just one is part of the other.
Dementia is the broad category.
Okay.
There's several different types of dementia under that category. There's Alzheimer's dementia, named for Dr. Alzheimer. There's
I did not know that.
Frontotemporal dementia. There's vascular dementia. There's Lewy body dementia. We recently, in the last few years, have started talking about CTE, chronic traumatic encephalopathy.
Football players.
Right, which is another type of dementia. So there's
caused by blows to the
head, and we also have seen it in boxers.
Oh, gosh.
Ali.
Yeah. Well, punch drunk. We've heard that forever, and that's basically what that is. Right?
Absolutely. And so there's many different presentations of that disease. It's all trauma and it's all impairment in the brain of different pieces of the brain at different times. But dementia is the hallmark: cognitive impairment with inability to organize things, inability to be able to remember things short term, inability to learn how to do new things, sometimes frustration in behaviors because we can't do what we used to do.
Right.
We don't know how to cope, so we get kind of frustrated.
That's a section I want to talk to you about in just a little bit too, is about the frustration that people may feel while they're going through this, and also the frustration that can be felt by caregivers as well. So I want to move on and ask about testing and how you feel about the testing that is done to detect Alzheimer's. Are you confident that the tests that are being used right now are good ones?
We use the best we've got.
Okay, all right.
So, do we have a great test that just goes bing and says this is it? No, we don't. So
it's a subjective call sometimes by a neurologist or someone like yourself, or are there things you can point to say that proves that this person has Alzheimer's or dementia?
We can do that. I can say to you unequivocally, this guy has cognitive impairment, this guy probably has Alzheimer's because of the presentation, but it's late in the process when we do that.
Right.
Because our testing just isn't sensitive enough.
Okay.
So we're working on testing, but we're way down the line. One of the tests that we give is called the mini-mental status exam, where you have to score a certain number of points.
Okay.
Well, you and I, hopefully, well, at least me, maybe not you, because of your toothbrush incident.
Yeah, right. It's right around the corner.
Hopefully, you'll get 24 points or more on that. When we're down at 23, we start wondering about it. When we're down at 18, then we're sure.
Okay.
But you're late in the disease. We can test a lot of things. So now we've got a new blood test that's in phase 3 trials right now. And the blood test may actually tell us really early on who's got Alzheimer's or who's really predisposed towards it. So then we can start doing more about planning
that is
for.
new, because I didn't know that there was blood testing that was being used in this arena at all.
Oh yeah, they've tried to come up with a whole bunch of things. There's a fairly expensive test that's done with what's called a PET scanner, where you inject a substance in the blood and it goes to the brain. And a certain amount of it attaches to the neurofibrillar tangles, and then they can measure how much that is, and they can tell from that if they think that you've got currently Alzheimer's disease, if you're also showing symptoms. But it's a very expensive test. It can't be given everywhere. It's not easy for most people to get.
Okay.
So
the bottom line is testing is what it is right now, but we can live with it for the moment.
So what I do
Needs
is,
to be improved.
as a clinician, what I do, I'm at St. Joseph Hospital. I'm head of geriatrics for the hospital. So all of our patients who come in, we screen them. We do a screening test, which isn't going to tell us definitively how bad you are or where your problems are, but it'll give us an idea if you're doing well cognitively or if maybe there's some impairments that we need to ask your doctor to follow up on.
Okay.
So there's basic screening tests. We talked a little bit about this. One of my favorite, and I know you've liked it also, is the clock draw test. Clock draw test is a very interesting test. It's always fun to watch somebody. You give them a page with a circle on it and then say, draw a clock for me and make the hands at 2:15.
Right.
And then do they get the hands do they get the numbers right?
They use that. We did that with Dad at the neurologist every time we went in there. So they're testing the progression.
Right, and you can see changes in it, and it's a real interesting test. And so that's actually one of the tests that I think that it's a good indicator, but it doesn't really tell you where in the disease process you are.
I brought that up with you yesterday because I had seen one. We always saw it when Dad was doing it in real time, but I never did see one from when it first started until when we got here. But there was one that they showed online yesterday, and the first 5 o'clock clock was perfect. And they actually didn't even put the circle. They asked them to draw the circle, put the hands at 5 o'clock, and put in the numbers. And it was accurate and easy to tell what it was. Second, third, fourth, fifth. By the time they got down to the 6, and I didn't see the progression of time between each one, there was a 5 and then a little stick right next to it, and that was it.
It's interesting because if you look at people as they progress, and then you understand the different types of dementia they have. Mm-hmm. So if you have what's called Lewy body dementia is the dementia of Parkinson's disease.
I've heard of it, yeah.
And so they'll have these tiny little numbers and tiny little hands. You'll have a clock that's that big, and they'll have these little numbers.
So it's a spatial thing too.
It's called micrographia, and so they have really tiny little handwriting, and that's one of the hallmarks.
We have lots of terms to Google after this show today.
Tiny little writing, and so it's really interesting to see that. And when you're looking at people put their clock together, sometimes they'll draw 1 as their first number. Numbering starts with 1, so where 12 would be, they'll put 1. right away you know their executive function and their understanding and their ability to organize events is impaired.
That's fascinating to me. I want to talk about drugs for a second.
Okay, if you've got a problem, admit it now.
Well, I didn't want to have to do this live, but it started when I was 13. No. Dad, for instance, when he was officially diagnosed in 2007, they put him on Namenda, which at the time was the best thing that they had. Actually, he was on that until we got here, and now he's on that combination of the two drugs. But how do you feel about where we are as far as medication or drugs go?
The medications don't reverse disease at all.
Right.
They can slow it down. They can, for a short period of time, help with symptoms. But you have to understand when you get to a certain point, you're going to be getting more side effect and more problem than you are benefit.
I want to ask you something. Tell me if this is accurate, because this is how it was explained to me, and then I've had other people say this isn't right. But as far as what drugs can do, it was explained to me that, of course, there is no cure, but that there would be a slight dip and a plateau, then a dip and a plateau, and that what the drugs do was actually kind of lengthen the plateaus. Is that accurate? Or
that is accurate, but it's a question of how much they lengthen it.
okay.
For some of the drugs that have been studied pretty closely, especially the early ones, 48 weeks is the time that it lengthens the plateau out to.
Really?
Right. And so you think, well, if I've had you on that for 5 years and you continue to get worse, maybe it's time to stop it. I will tell you, these drugs, like everything, is not without side effects, particularly in terms of GI side effects. It can hurt your appetite, it can cause upset stomach, it can be difficult for bowel movements and things like that. And so if you're having symptoms like that, particularly gastrointestinal symptoms, I recommend talking to your doctor about maybe reducing or getting off those medications if they've been on it for years.
What is the drug that I'm thinking of? That's just the name is not with me. It's the combination of two.
There's more than one.
Okay.
There's a bunch of those now.
Okay.
And the reason why they do that is they lose their exclusivity as one drug.
Okay.
So then they combine it with another. So now it's a quote unquote different drug. So now they get a new patent on it.
Okay.
So they get their exclusivity and they can market it under that name, and it's higher
You mean
price.
there's a monetary factor involved?
I know you find that hard to believe, but it's true.
Shocking. Okay, I'm checking the clock to see how many of these we're going to be able to squeeze in. Just a basic question of what part of memory goes first and what part goes last, if that's common.
It depends on which type of dementia we're talking about. So let's talk about Alzheimer's. With Alzheimer's, the very first thing is usually memory and learning.
Okay.
So you all of a sudden notice that dad can't remember your name or his wife's name or his address.
Right.
And then
With Dad, it was very unusual. He flipped the thing that gave Mom the heads up. He flipped Valentine's Day and Christmas. He called Christmas Valentine's Day during that holiday, or vice versa, one or the other. And she just said, "Oh, that's unusual," because Dad was a sharp guy, and is too. And but also that he was very meticulous about the way he took care of bills and put together his mutual funds and moved things around. He had a whole chart that he did. Some of that was starting to, she could tell that something was not quite right there. So that's when she got into the neurologist. But that's a common thing.
Yeah, and not being able to take care of your finances is one of the tip-offs. That's absolutely true.
Right.
Some of the others that we see quite a bit are sleep-wake cycle disruption. So you're up all night and you're sleeping all day. Simply because your body clock has gotten thrown off by what's going on with your brain.
Okay.
I call it reverting to the teenager.
Yeah.
They want to sleep all day and then be up all night.
Right.
And that has a huge part of caregiver burnout associated with it, because it's hard for those who are helping take care of them
Right.
to deal with that. But memory and learning are the first things. And then talked about keeping those charts, that's executive function.
Okay.
So your ability to organize things in a fashion that you can execute a plan is that. It's like drawing the clock. A lot of that is executive function.
Physical aspects of the disease, and I was curious if you see someone maybe that is having problems walking or even incontinence. I don't know if that is part of it or symptoms of, or one cause is associated with the other. What are the physical what are the physical aspects to Alzheimer's that you see?
The physical aspects partly depend upon what type it is.
Okay.
If you have Lewy body dementia, the dementia of Parkinson's, you're going to have typical Parkinson's symptoms.
Okay.
Shuffling gait, stooped, stiff, rigid, and shaking.
Yeah.
If you have Alzheimer's dementia, you're going to lose some of the ability to move quickly. You're going to be a little bit slower usually.
Okay.
You're going to have a little bit more trouble with fine motor. It's going to be a little harder for you to button things up, and it may be a little harder for you to pick up a utensil to eat and feed yourself.
Because your brain is not talking as it used to the rest of your body.
You don't recognize a lot of those things the way you used to.
Okay.
You just don't understand sometimes why you're doing what you're doing.
I want to talk about the mood of sufferers. We're very lucky in our family that we haven't had to deal with anger or violence or anything like that, but I'm well aware that it's out there. So how does it affect sometimes those things like anger and violence? You see people wander away and they have desire to get away, obviously, and some deal with that and some don't. And then also there's frustration, I know, that goes along with the loss of independence. And it's not something maybe that they could put into words, but they know, hey, I'm not driving anymore. I'm having to be driven everywhere. And just subconsciously, I think they have to be saying to themselves, this is frustrating. So
It is. Last week,
that's a loaded question.
It's a great question, though. Last week, I was looking at a gentleman in my hospital who had come in for a hip fracture. And he had had his surgery, and so I was just doing my evaluation on him in terms of cognitive function, just to sort of get a baseline. One of the questions we ask is, can you tell me the months of the year backwards? December, November, October. He got angry. He got real angry. He threw me out of his room.
Really?
Because he
wasn't able to
couldn't do it. And so mood.
Was that connected to embarrassment? Which manifested itself into anger, or
he knew he couldn't do it.
Yeah.
He knew what the implications were of not being able to do it.
Okay.
And he didn't want the label. Most people know they're getting into some sort
That's
of.
what I was going to ask you about. So someone that's suffering from this, they're able to tell themselves, I guess, for a certain length of time anyway, I am aware that I'm not functioning the way I used to function.
Or even if I'm not aware right up front, I know inside of me I'm not right. I can look